just mention a few of those things. One of those things is that coming up in about a little bit more than a month from now, if you have children under the age of 26, you will be able to keep them on your health care policy. Presidents far back as Theodore Roosevelt wanted to see it, and it came during our lifetime. It came just during the last year. But still, because the benefits are being staged in, and they're not all at once, it's important for us to continue to be good stewards of information. Another very important thing, preventative care for seniors, free. You can go get it now, and this is something that's important. This is your blood sugar, your blood pressure, all these kind of things that can keep you healthy.
And you know, there were all the folks out there making up stories about it, and you know, you had no idea what was true and what wasn't true. The unions were there. The unions were there talking about what was really in the health care bill. They were saying, you know, don't listen to that BS. We know the truth, and the truth is that too many seniors don't have access to the kind of preventive coverage that Keith was talking about. How we made sure, from children to seniors, that the care you're going to need is going to be there today, tomorrow, and in the future.
What we're going to do when we get back is we're going to immediately work on jobs and the economy. That's the major focus of the Congress. And the fact is that even though Minnesota's unemployment rate is lower than the national average, for anybody who's out of work, it's still a real serious problem. So we'll be working on issues of making sure that people can, bills that will help people get into their homes, re-weatherize their homes. Hopefully we'll do some stuff on public employment.
Well, I'm hoping that we're focused on creating more jobs, and I'm in the House of Representatives. We passed a great bill to get more small businesses back to work, and so I'm going to go back and encourage the Senate to pass the small business bill so that we can put even more Americans back to work. You know, the Tea Party, I haven't heard what they're for. I've heard what they're against. I've heard that they're against making sure that pre-existing conditions are covered in health care. I've heard that they're against making sure that we close the donut hole for seniors, and I think when people find out what they're against, they're going to say no.
I think it was a good start. It wasn't as strong as I'd like to have seen, and I hope that improvements are made in the future, but you got to start someplace. I think they could do it is to let the Bush tax cuts expire. That'll be a step in the right direction, and the other is let's bring the troops home. I think we've done enough. I don't know that it's going to accomplish much more over there. That'd save a hell of a lot of money.
It passed. I'm quite surprised that it passed, but I'm happy.
I'm still a student. I have one more semester left, and I just think it's a shame that some people get turned away for health care when they really need it, especially if they have pre-existing conditions as simple as diabetes. They end up paying out of pocket hundreds and hundreds of dollars every month, and who can afford that?
Thumbs up.
There's money for your health.
Act. Well, as somebody who is about to start paying for my own health care,
we ask your support in the coming months.
It's really hard to be unemployed and have to pay for your own health care.
Ask those tough questions.
Having two kids, it makes a big difference. When my son was born, it cost me about $15,000 out of my own pocket.
But I can see that they're trying to go in the right direction, but I'm not sure this is the right time for it.
Good for America. Guess we'll find out.